I'm so thrilled to have you two on. This is kind of a, I don't know, it feels like a full circle moment right now because I remember last year when I was dreaming up caring for mama and kind of scoping out the scene of what was happening out there for those caring for mamas. Spark Mamas was one of the few organizations that popped up, and I thought, well, first of all, should I try to do something because they're already doing something that I basically envisioned. But then I thought, you know what? There is so much need and so much, yeah, there's just so much opportunity for more of us women and moms to speak up and to share our hearts and our gifts and our, everything that we can really to make change in this space of maternal care and maternal mental health. So I just wanted to open up to say thank you for inspiring me too, as I was launching Caring for Mama, and for being such great collaborators and supporters, both for me and for all the women out there. Um, so with that being said, I am introducing Amber and Chelsea, who are the founders of sparkmamas.com. For those who don't know, it's an amazing, basically what, and I don't know if this is how you call it, but I think of it as like the registry. It's, the registry you think of going to for your babies. This is the registry you go to for your moms or the moms in your life. So it's this clearinghouse of, carefully vetted providers and actually one product, but providers who offer a variety of support services for postpartum mamas. And it was so refreshing to see as a mom who's had two children and didn't have that, I didn't know that existed. So I guess to start, we're going to talk all things maternal mental health today, you two being experts in this space. But first, I want you to talk a little bit about the inspiration for starting this. And I think a lot of that is why, it kind of sets the tone for why we're even having this conversation, because there is so much need. So I'll let you two take it from here.
Oh, well, thanks, Kim. I think you spoke to it. We know that so many women need all sorts of care throughout that transition of motherhood, not just when they're pregnant or they're immediately postpartum, but throughout the longevity of their journey. And part of what inspired us to build Spark Mama was meeting moms in their seasons of new motherhood and them showing up in our office and just not knowing what they needed, right? And so part of our job is to kind of listen for where they're at, if they're confronting a perinatal mood and anxiety disorder, and how to best intervene, but also where is their community, where's their relationship, what kind of internal support systems do they need, and what ancillary support systems do they need. And I think starting to find a way to get moms thinking about that before they're in the throes of postpartum period, right? So how do we help moms re-envision not just taking care of their baby postpartum, but also taking care of themselves? Because we know that if mom is okay, the likelihood that her family system is going to be okay is pretty high, right? And so wanting to help moms think about, they're so careful about what we eat and how we take care of ourselves because we don't during our pregnancy because we want to protect our baby in utero. But then once that baby's outside, and in the world, often all of that energy and that resources goes to the baby, right? You think about even the OBGYN visits and the pediatrician visits, like those trail off after 6 to 8 weeks postpartum visit. But then you're interfacing with people who ask about the baby. And we know that we need to take care of our moms, not just throughout the pregnancy phase, but throughout their whole motherhood journey. And so that was a lot of what inspired us to create Spark Mamas, is how do you make sure that you're not only thinking about yourself as you transition into motherhood, but that you have the resources that you need, that you've already established care with them. So whether you're struggling or whether you're maintaining or whether you know something just isn't quite right, you know where to go. Perhaps you've already bought a gift or somebody's bought a gift for you, or you can kind of peruse through our online web space and be like, that sounds like something that would actually help me feel more connected to my child or my partner.
No, that's great. And I neglected to mention where you two come from a professional standpoint. I see some of your the diplomas behind you and credentials behind you. So it reminded me that we should also share, what you two do for a living in addition to starting Spark Mamas. And Amber, maybe you can chime in too about your piece of the story.
Sure. I'm a licensed marriage and family therapist and mother of two kids. And I started the program up at UCSD, the Women's Reproductive Mental Health Program, in 2006 with an OBGYN and several other colleagues. Unfortunately, after the suicide of a mother there who was not able to get the needs that she needed at the time. And our program is embedded in the OBGYN clinics there. And so we work in a collaborative care format with the OBGYNs, the midwives, and the medical team there to provide care during pregnancy and up to 1 year postpartum. And I met Chelsea through our work at UCSD, where she was a clinician there as well. And then outside of my role at UCSD and Spark Mamas, I also have a small private practice. But I'm trained as an early childhood therapist and a postpartum doula. So I also bring those pieces of my work into the care of mothers, not just in the pregnancy, but in those first 5 years of life and sort of that lifespan in terms of those transitions.
Perfect. Yeah, it's just I think the fact that you two are bringing like real, I mean, it's what you're seeing. It's the reality of what we're experiencing. It's just not always what we're talking about or what we see surrounding us, right? And that's what is so important to me about these conversations in this series is that we get to the heart of the matter and like what's really going on and how we're really caring for moms out there. And I love the integrative care that's happening at UCSD. I think it's brilliant, and I'm hoping that that gets replicated more quickly than it might be happening. I'm not up on all the systems out there, but it just feels like integration is just so key in all aspects. So it makes me think maybe we can step into some of the broader kind of what you're seeing, and if there's been any sort of shift, and I'm hoping for the better in recent years in terms of maternal mental health. I know we've hit crisis point, but do you feel, being like on the front lines and seeing women every day and being a part of this system, do you feel like things are starting to move in the right direction, or can you give us kind of a finger on the pulse of how things are going, and then we can start to shift into things that moms can keep an eye out for, ways that they can be proactive and take preventative measures as they head into motherhood?
Mhm. Yeah, I mean, I definitely think, at least, I mean, when I started at UCSD in 2006, from where we are from now, I can definitely tell you we've made significant strides in the field of maternal mental health. Providers are asking questions, they're screening, they're wanting to get them resources. I think the issue now is there's not enough providers and too many patients, actually, because we're actually identifying and screening and assessing, which is fantastic, right? Because before it really wasn't as much on people's radar. So I think there is much more prevention around that. Even in the field of maternal mental health, we now have the ability to be able to get certified in perinatal mental health. And that's like a new development, so that we have some kind of measurement to make sure that providers are providing competent care. That's new in the last couple of years. And so from my perspective, for sure, there is a lot more screening, assessing, and treatment, and competent providers in the community that are providing that. And we're also seeing, and that speaks to some of our providers within Spark Mamas, is that there are different ways to provide care for mothers. And so what we're seeing is this diversified, like, trajectory of being able to care for moms that not just one particular thing. They may not just need mental health, they need pelvic floor, they may need a lactation consultant alongside. And that's part of the goal of Spark Mamas, is to bring those providers, knowing that each of those people are developing different skill sets and offering solutions to a problem that all of us are identifying, and finding a different pathway to be able to meet the needs of mothers in a diverse way.
Yes. Well, I'm very encouraged to hear all that. I think I have a sense of that, but it's nice to know that there's actual like concrete, the system is also moving, not just what we're seeing in supportive communities or, the practitioners that surround the perinatal period. I know I had to create my own team. And I found it because I needed it, but it wasn't easy. I had to really work hard to create that team around me. So I know that's a big part of what Spark Mamas is there to do. It's to really be a resource. I see it as an education too for women heading into motherhood, to understand what they may need that they're probably not even thinking about. I know I didn't know what my pelvic floor was before I got pregnant.
Yeah.
So For those, I mean, there's probably going to be a lot of different people listening to this at different points. I think there's a couple of ways we could go here. Talking first to the moms who were listening, maybe new moms who are wanting to, maybe get some tips and things to maybe feel a little more grounded in their current reality, because it can feel very chaotic. And then there's also the providers who might be listening who are like, oh my gosh, what's this Spark Mama? So I think there's a lot of opportunity both in supporting the moms who are listening and also maybe inviting some new practitioners to potentially join this amazing site, because it's kind of, I want to say it's like a gold mine, but it really is. I feel like every woman who is becoming a mom or is already a mom should know about Spark Mamas.
Well, sometimes I joke that I built this business for myself because it kind of coincided with my IVF journey and then my transition into motherhood, and being able to really add the Spark Mama's gifts to my registry and to feel like I had these different, checkpoints with people all throughout my journey that I lined up before my baby was even here, right? So I lined up a lactation consultant, and thankfully we didn't have a problem with nursing, and that I was very grateful for that. But then I was like, well, what am I going to do with her? But she knew exactly what to do. She came over to my house and she supported both my son and I with exactly what we needed that I didn't know I needed. I same with having a pelvic floor therapist, right? I put that on there because I've heard, in my 13 years of experience, I knew that a lot of women talk about peeing themselves, and I know that that's not normal. So I added it to my registry, and I didn't think I needed to go because I had a cesarean birth, right? And so being able to still go to these support services and be really cared for throughout my transition was something that I just wished for all women, because there are so many resources that, you might think, oh, my mood's a little bit funky, right? And so we asked, like, well, where do you go for that, right? And there are tons of resources, some of which we'll share with you so you can add them to the episode notes. A great resource is Postpartum Support International. Our local chapter of that is PHA, and being able to learn more about what are some of the things that if my mood is struggling, what might that look like? What might that sound like, right? And for every woman, it's going to be a little bit different. Knowing that I might have aches and pains and I might not feel right in my body, if I can sit and talk with a Spark Mama's provider and tell her what's going on, she's going to have the experience and expertise to help me figure out what it is that I need, right? And so I think that's one of the things that I encourage for all moms. Like, you don't know what your adjustment to parenthood is going to be. You've heard so many stories, you've seen so many pictures, you've heard your friends' experiences, but everyone transitions very differently as a result of their child's temperament, their support systems, so the way their body recovers or doesn't, right? Like, it's so figuring out, just because I don't feel great doesn't mean that's just motherhood, right? Because that's what I've heard my friends say. How do we go from being able to have the kind of experience where I feel good in my body, I feel confident in the decisions that I'm making as my child's mom, etc. Right? And so that's one of the reasons, really, what the inspiration behind Spark Mom is, but also what I hope for so many moms is to be able to say, okay, I don't feel great, and also how do I go from not feeling great to feeling better, right? And if I'm in the trenches, what is it that I need? Who do I need to get me out of it, right? I think that the primary barrier for a lot of women is guilt, right? And so guilt around spending money, taking time away from their families. And so how do we know that guilt is there, put it alongside of us, and still do what we believe to be the best thing for us, and care for the self the same way we would for a friend or for our child?
Yes, as you're talking, it makes me think about, well, first of all, the need for us to continue to work hard on shifting the narrative that we have in this country about what what being a mother is, what it looks like, what it should be, and full striking that out of our of our rhetoric. But I think that it sounds to me a lot like an awareness, like a self-awareness, right? Or like those questions that you said, those reflective questions. Okay, I'm not feeling, just like recognizing what's happening in your body, what you're feeling, and saying, okay, I don't feel good right now. I don't know what's happening, and that's okay. I know I can ask myself these three questions, and I can put those back in the notes too, which is like, what do I feel like I need? who can I talk to, or but just going through really simple questions. It's kind of like the five senses. It's like when you're having an anxiety attack or something, it's like, what am I feeling? What do I see? What do I, and what can you focus on to take you out of that feeling? So I think something really tangible like that is really helpful. As I know, I suffered postpartum. I didn't know what I didn't know, especially with my first. And so maybe you could go a little bit further with that, so I can add some specific notes for people listening. And those two that are on, if anyone wants to ask questions, I'm keeping an eye on that. So feel free to ask questions, and I'll weave those in. But I'd like to talk a little bit more about how to kind of build in that self-awareness and self-compassion before we move on.
Yeah.
I was thinking about one of the things that Chelsea and I hoped with Spark Mamas that would help to some degree with that is actually looking at and curating a registry before your baby arrives, right? And by actually just going through the gifts, it starts that process of self-awareness. It starts that process of checking in with what you think you might need and educating yourself through the process of that. Like, oh, I might want to connect with my baby, but I might feel overwhelmed at how to do that. Here's some potential resources at being able to do that. And so preventatively, the self-awareness part starts with, from an education perspective, even recognizing that I'm going to actually make space for me in the context of this major transition, right? Versus I'm just going to make space for the well-being of my baby. We're hoping that that education starts that process when they're beginning to, even before they get ready to even conceive or they're thinking about conceiving, that they're actually doing that part of it. And so for me, the self-awareness starts in pregnancy, and that actually coincides with perinatal mood disorders. Oftentimes we're talking about it from a postpartum perspective, but really we want to start treating a mood disorder in pregnancy. And so for people to start to think about, hey, if I have a history of mental health, or I have a history of there's some potential risk factors that we might have, to start to seek out those support systems early on in their pregnancy starts that process of they're making space for themselves and not just for their baby in the context of that transition.
Yes. Wow. Yeah. There's so much education for women as we're moving into and through the motherhood journey, but for those surrounding us, right? And just that our support systems who haven't experienced this, or who, our partners who won't be having children themselves. I think there's this beautiful opportunity too we have as an extension, or using Spark Mamas or the Caring for Mama platform as a way to for lack of sparking conversations that are really important to say, this is the awareness that I'm building for myself as I am venturing into motherhood and experiencing all these different things, physically, emotionally, spiritually, all the things. And like inviting your community, whoever your community of support is, to join in that conversation and to take a look at Spark Mamas and to understand what's really going on. And for those who don't have that support system, I guess my next question would be, is PHA, for those locally in San Diego, that's Postpartum Health Alliance, is that a good first step to finding a potential, therapist or someone to talk to? Or what would you say is the next first step if they don't feel like they have someone they can confide in?
Absolutely. One of the things that Amber, identified is that this conversation starts in when you're pregnant, right? And so that idea of how do I have some of these conversations, not only about my risk factors, but those support that I might need, right? And lining those up and having those point of contact will decrease the challenge of trying to navigate them in the postpartum period. So one of the things that I love about PHA is you can call, you can talk to a Loremind volunteer. You'll end that call with a handful of resources and referrals. Some people prefer a support group, right? And that's a way to build connection and community. Some people prefer working with a therapist, right? Some people might need a lactation consultant or a postpartum doula to help them sleep. PHA is a hub of all of those local resources. And I sometimes think saying out loud to another person and just exploring what your options are. I know that in my work as a therapist, when I meet with a client in the throes of it, I'm shocked at, you're just in it, right? You're just in survival mode and you don't know what you don't know. So being able to identify, hey, there's all of these resources. You don't have to do it alone. And I think when you're just surviving, you do feel that way. And so how do we start to, one, identify those in, the pregnancy period and identify resources, whether it's Spark Mama, Postpartum Health Alliance, talking to friends and family and being vulnerable enough to share where you're at. And then when you're, in that postpartum place of how do you stay open to engage in some of those resources? And how do I give myself maybe permission to access them? And that might be a therapist giving me permission. It might be my partner giving me permission to do that.
Yeah. Okay, great. And for those outside of San Diego, I know that there's the Postpartum Support International. Would that be then the same idea,
Mm-hmm.
but you could find it throughout wherever you
Yeah.
are in the state? Okay.
They have a providery listing of resources for every state and actually countries. So that piece would be like an international, but they do have online groups that they offer for every state as well. I just wanted to add something that Chelsea was saying that I think is also important in terms of like building your support network also starts within your family system and also within your support system with your medical team, letting them know about what, if you have a history of something, both from a mental health perspective or otherwise, but also bringing your partner into those visits, as well as having conversations with them about how you guys are going to thrive for your whole family system and not just like the mother themselves, right? And so one thing that, Chelsea and I do both in individual practices, and we have it as like a gift through Spark Mamas, is we do postpartum planning with our family systems. And that is for us is to try to get the whole family system treated in terms of what they're going to need as they're transitioning as a family, and the partners being involved in that process helps supports mothers in a completely different way and gets them educated as well, because they might not know that they're not okay, but their partner would know, and their partner needs to know how to access those resources as well.
Yeah, it brings up a good point too that, I think I have a partner and a lot of people do have partners, but sometimes I take for granted that there's a lot of people who don't have partners or have opted into to starting motherhood solo, and I honor that. And there's just so many ways to be a mother
Yes.
and experience motherhood. And so I think the point of the support system and the community, whoever that is, right? And making sure that there's that person who can serve as that partner in this journey that can be educated alongside us. I am seeing some notes here about, so question about how this, I know you sort of touched on it earlier, Amber, about our systems of care and how this integrative system is taking hold, like at UCSD, and I'm sure others as well. Is that something that you see, like, how do we expand on that, or how can we? Is that something, I know systems work is not, flip a switch and snap your
Yeah.
fingers. You see hope in
Um,
expanding.
yeah, I mean, integrative behavioral health systems are not prevalent at every site. UCSD has them in family medicine and in reproductive medicine and other departments, but to my knowledge, they're not necessarily like the common practice, at least in some of the other hospital systems. But everybody is screening at this point in terms of women during pregnancy and postpartum, and oftentimes they'll either provide a referral or they might refer them to somebody within, like, let's say, an outpatient mental health clinic within like Sharp or Scripps, but not necessarily within the same like department or with that particular specialty. But they are screening and providing resources. But it's definitely an endeavor to get an entire system behind a collaborative effort within the OB/GYN clinics. I mean, I wish that this was the standard of care everywhere, and it was not without a lot of growing pains, I assure you. So it took a lot of growing pains, but it also took a team of people who believed in that as a model of care and continue to believe in that to maintain that over time. And a lot of that is education. I do think that a lot of providers are so aware of it, and they're so busy with like the visits themselves, just the medical side of it, that being able to have someone alongside them who can treat that part of it too is also makes their jobs easier in different capacities, and it allows them to provide the care that they really need to be providing sometimes versus like being able to try to address all those pieces. So I think there's a growing sort of awareness of that as well.
Yeah, and understanding how over time how you see the benefits that you can say this is the hope and this is the vision. But over time, as you've experienced UCSD, how you can see um, how this kind of integrative care impacts, like truly impacts women's experience through the perinatal period. I mean, that speaks volumes. I mean, that. So anyway, that's a personal soapbox I could get on, because both periods I went through on my 6-week visits, I totally passed, and
Yeah.
I have passed. So I'm not really sure how I missed that, but so that's my personal concern about those screenings, is that I think a lot of women are falling through the cracks.
Yes, for sure.
So that leads me to my next question. I know we got to wrap soon, but we could talk for hours, but I don't want to keep everyone that long. I wonder about, wow, I just lost my train of thought.
Welcome to motherhood.
It's like not just me.
uh, I had such a good point and I just missed it.
One of the things I did want to, Amber highlighted the way that UCSD does this, right, through both the screening and referral system. And I love the idea of, as more moms become aware of like postpartum depression, not just being postpartum depression, about it affecting, including anxiety or OCD. I feel like we as a community, and I never take for granted that I'm in it, so I am aware of it, but that I think collectively we're having more conversations about women's mental health throughout reproductive transition. And so I always encourage women to talk to their OBGYN early on. Like, this is something I'm concerned about. Can I touch base with you, throughout my first trimester, second trimester, third trimester, as I'm gearing up for birth? It's exhausting having to advocate for yourself, but starting to have those conversations earlier, preventatively versus when you're in it, I think can be really, really helpful,
that's
especially establishing safety and trust with your provider.
Yes, advocacy. You just triggered my question, which was for those of us like me and like us and others listening, and many women who I have been meeting over the last several months, who are passionately advocating in their own ways for maternal, better maternal care, better maternal care systems, and mental health supports. What would you say is the best way to advocate, aside from just doing, you know, supporting ourselves first, right? Caring for ourselves. That's the best way to advocate within ourselves and our communities. But beyond that, is there a organization or association that we could get involved with to help try to shift this behemoth?
I mean, I think the first one that obviously comes to mind that's local is Postpartum Health Alliance, but I think there's lots of different organizations that provide support for moms in very different ways,
Mm-hmm.
that are, whether it's in the form of like clothing and basic needs versus like health and nutrition. And so there are lots of different organizations I think that can provide that. And Chelsea and I can certainly provide some resources for that in the notes around some ones that might be, I think it's what you're interested in, right, to some extent. But I was also thinking about just this idea that I think that advocacy also starts with people being open about their experiences with other mothers, right? Because I think that there's a stigma around the sharing of that experience, or sometimes suffering in silence a lot. It's like they know it's out there, but is it safe to be able to communicate that, and what will people think of me if I do that? And so being able to actually just share that more openly with friends, that they're not okay, or that they didn't like breastfeeding, or that their baby isn't sleeping through the night and they're still sleeping in the same bed as them, like whatever it is, I think there's a sense of like needing to tell a particular narrative. And so the advocacy for me also begins with like breaking down those stories, that motherhood is much more than just these perfect narratives, that we're not upholding around that, and having more honest conversations with our mother friends and our friends around it.
Yes. Yes, I'm definitely adding that into the notes, because that's a big one. Open, honest conversations, even just within our circles, is huge. And not being afraid. I think coming through that, just as the woman yourself, being able to break through that and feel okay, feel safe, speaking your experience is a huge step. So I also want to give you a chance to talk about how people can, I mean, obviously going to sparkmamas.com is, you can see everything, right? You can peruse there's no paywall or anything. You can buy one-off things, and it's like a traditional registry in that way, I guess. Um, but maybe you could speak to for providers who are interested in becoming a part of Spark Mamas, for women or those wanting to gift moms in their lives, how they can engage with Spark Mamas and any other upcoming events or thoughts or last thoughts you want to share before we close.
Yeah, definitely adding Spark Mamas to your registry is a great way to, one, have that open communication about what you may need, and also get people to support you in that. Sending a one-off gift is pretty easy to do, right? Sometimes I'll text Amber and be like, "How can I help you?" And when you're in the middle of something, you don't always know what to say or what might be helpful, right? And so I can at least send her a gift card to go get her toes done, right? And that might be one way of saying, I see you, I know you're going through it, and I can't be there hold your hand, but I can make sure your tootsies feel good, right? I think from a provider perspective, we love partnering with providers who are aligned with our goal of supporting women like yourselves, Kim. And one of the things that we love about our community is we have a Google group so we can communicate with each other of like, hey, I just saw a mom and she might need your services. Is there any way, that we can communicate around how we might support her together, right? So we encourage providers to, if you're on Instagram, to go online and fill out a form, or just email us directly at hello@sparkmamas.com. We're in the process of revamping. It's a little teaser of what's to come this year. We're revamping our website to include more providers, more resources, and an easier way to navigate our website. So if we're definitely looking to connect with more people who are aligned with our mission for this upcoming year.
And if you have an idea about a way to help support moms and it's a gift that you think we can give, we don't know all the ways yet either, right? And so sometimes you might have found a creative way that wouldn't be so obvious. And so if you know of a way that you've supported a mom and you have a business, we really are at aligned with supporting women-owned businesses. And that part feels really important to us in terms of that, as well as also, I don't think we mentioned this, but a big component of our gift giving is that we give back to a nonprofit each quarter. And so the nonprofit is our way of being able to, we know that not everybody can afford the gifts that we provide. And so being able to support every mother at different stages of their, if they have financial difficulties in different capacities. And so if you are a nonprofit who is interested in potentially partnering with us and supports mothers who are underserved in some way, we are interested in trying to connect with those groups of individuals as well in the community. Yeah, I think that's also something.
That's a great point. I do remember that, but we're working with the Community Resource Center up in Encinitas, and they're doing such great work for moms, like so many other organizations here locally and all over. So I'll definitely keep that in mind as well for referrals in the future. And I will say too that we were able to collaborate and get one of the Caring for Mama boxes on the Spark Mama site, and we have a Spark Mama's gift certificate or discount card in our boxes. So that's a great example of how women-owned businesses loving and supporting moms, how we're able to come together and do more of that. So I would echo that, for other women-owned businesses out there that have share in this mission with us, reach out to either of us, hello@caringformama.co, hello@sparkmamas.com. And, even if you just want to share your thoughts or suggestions, I know I guess I can speak for you too as well, that we're very open to that. And I'm just really grateful to be in community with you too. And I'm excited to see what's coming with Spark Mamas. Sounds like there's more to come. So we'll keep an eye on that, and we'll get this recording up with more notes soon. And yeah, is there anything else you wanted to close with before we wrap up?
No, I just wanted to say thanks for creating this opportunity for us to connect. I think it is a trickle down effect. It reflects what we're trying to do within our organizations, and that feels really meaningful in a lot of ways, to be able to connect with our providers one-on-one and to be able to share what you're doing and to share how we're connecting around that feels really meaningful.
Okay, thank you so much. much. You both are amazing, and I'm grateful. And I will talk to both of you soon.
Thank you so
Thanks so much,
much.
Kim. Take care.
Thank you.
Bye.